Thank you very much for allowing me to talk about labiaplasties. Many women come to me for a labiaplasty almost always for cosmetic reasons, in that they're just self-conscious and they don't like how it looks. The popularity of this operation has really skyrocketed in the last few years, and it's really because of three things. The first thing is a lot more women are doing Brazilians or something equivalent, so they're able to see what's down there a lot better. There's a lot more public discussions about labiaplasties. It's in a lot of magazines like Cosmo and Vogue. Apparently it's on some of the TV shows, they'll discuss it. And third, more and more women are seeing other women without their clothes on, so they're able to do somewhat of a comparative idea of what they think should be how they look. So many women are self-conscious about how they look in the labial area. Most of the time, if not all the time, it's because the labia project farther than they would like. Very often there's asymmetry between the labia on each side, and one side will stick out a lot farther, and women don't like that as well. In addition, some women find it symptomatic. When they're longer, it will tend to rub on their clothes, particularly for things like bike riding. They'll get more irritated. Sometimes for sexual activity, it'll interfere. So those are all the common reasons why women will request a labiaplasty. This procedure is usually done in the office. I like to give you some oral sedation. I have you apply a numbing gel, which really makes it quite numb and very painless. I then, of course, inject some local anesthetic, but once the topical agent's on, the needles are not uncomfortable at all, and that will render the labial tissue completely numb, so you'll have absolutely no discomfort. There's principally two techniques for a labiaplasty, and this will be discussed in great detail when I see you, but there's essentially two methods. One is a trim method, which is what it sounds like, where I'm trimming the tissues that extend beyond the labia majora. The other technique is called a wedge technique, and think of it as like a piece of a fan that you're excising and then the lips come together. In both those surgeries, the vast majority of my patients will actually return to work in 3 days. Exercising is going to be about 10 days, and sexual relations varies from person to person. I've had patients resume sexual relations as early as 2 weeks, which is a little bit quick. I think average is 3 weeks, but every once in a while somebody's a little bit more sore and prefers to wait a little longer, and I'll discuss that with you. But it's a very common procedure. The satisfaction's very high with this procedure. Sometimes I'll do these under general anesthesia if somebody else or somebody's having a procedure that requires general anesthesia, such as a breast augmentation. I've had women that'll say, while I'm already under and you're doing my breast augmentation or my breast reduction, do you think you could do my labiaplasty? And there's certainly nothing wrong with that. Rarely some women will be apprehensive about having it done in the office, and of course it can be done in the operating room. That's always a little bit more expensive because then you'll be paying for an anesthesiologist in the surgery center, but it's equally doable, so it's really the woman's choice. I would encourage you to come in for a free cosmetic consult where I will examine you with one of my assistants and then discuss in great detail the different techniques and find out which technique would service you best.